Hey, good afternoon. We are back taking some testimony on S1, Section 6 of S127, an act relating to housing and housing development. And we have a impromptu witness that we're adding to the schedule. So the floor is all yours, Susan.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Susan Aronoff, and I am the Senior Planner and Policy Analyst for your state's Developmental Disabilities Council. It's a little bit of background. There are 56 developmental disabilities councils in the country. Every state and territory has one. If you get any email from me, you see I have a .gov address. It's because I'm located in the Agency of Human Services and the Secretary's affiliated council realm. But because we're entirely federally funded, we operate under a memorandum of understanding that allows me to depart from what the Secretary or the governor has to say.
Almost requires it, doesn't it? To be independent.
Independent.
Can I ask you a question just before we get into 27? With regard to federal funding of the developmental disabilities councils, the not disability law project, the you know what I mean.
Protection and advocacy.
Yes,
Disability Rights Vermont.
yes, Disability Rights Vermont, and the Center for Disability and Community Inclusion, UVM, all kind of a trifecta of tied up in that. And I'm just wondering, what are you hearing about federal funding for that group of policy and advocacy folks?
Thank you, Madam Chair, for that question. The official word is we're hoping to receive our approved monies for 2025.
Once you have the ones that started last October.
Yeah, the ones we've already been giving out.
Yeah.
Unofficially, we and all of our cohorts that you mentioned were part of a group of programs overseen by the Administration on Community Living. And there was a leaked budget memo that eliminated the Administration on Community Living. But because it's not official, we're all sort of chasing shadows at this point. The good news, we take it as good news, that the 2025 funding does seem to be being released. That's a change, and we take that as a good sign. The downside is what apparently they're going to attempt to do at the federal level is take all of the funding that went to these various disability enterprises and put it in one bucket that the state independent living councils, otherwise known as the SILCs, will distribute. The catch is, and people might not lose money under that scenario. The same amount of money might come into a state and be distributed. The catch is the federal memorandum that went out at the beginning, executive orders that address DEI, as we've all heard about, diversity, equity, and inclusion. At the federal level, there's an A in there. Diversity, equity, inclusion, and access or accessibility. So the SILCs are being asked to sign a statement saying they're going to give out all of this money the way they used to, but it won't support any programs that go towards the DEI and the A. So the SILCs nationally are pushing back, saying we have to do access work. That's what we were created to do, create access. So stay tuned on that. Would be the plan going forward for future monies. Right now, we're just keeping fingers crossed that we can be made whole on our 2025 monies. And I will say, Madam Chair, that in prior times when things like Medicaid and some of the other things that support people with disabilities were threatened, it was the legal advocates and the developmental disabilities councils and the Centers for Independent Living that really came together to preserve these social safety nets for seniors, for people with disabilities. And so I think it'll be very hard to mobilize and organize the way we've done in the past if these organizations that are active at the state level are eliminated. I mean, you guys all see me here in the building. I bring as many people with, it's because of you, Madam Chair, make every day Disability Awareness Day. there were some days I had 2 people, but I had people all session long, people with disabilities and their family members coming into the building. I don't want to blow my own horn, but it's very hard for people to get here and make the connections without someone like me in place to help them do that.
So I guess what I'm taking that is that it's still potentially at risk, and definitely likely to change in terms of access and what might be able to be done with those resources.
I mean, here in Vermont, if you look at the budget that was just passed, we are in the B section, B 303, I think, for 800 and something thousand dollars. Those are all federal dollars. We're one of the few councils in the country that do not get any state actual dollars. We get some in-kind support, but we pay for our technical assistance, a lot of rent and other things. But anyway, that was in part, we designed it that way. So I and other people like me would never have to come to the building and ask you for our salary. We ask you for things for everyone else. And, our cohorts at Legal Aid and other places have not had that luxury. They have to do both.
Yep.
We've tried to stay clear of that. The Secretary of Human Services and the Appropriations Committee, they have heard from us because that loss of $800,000 is lost to the state. There are positions, but we spend that money. The money that we
It goes out.
hire other people, we hire Allison Park, that's what we do. And so that $800,000 is a hit that's in the pile everyone's keeping track of. But honestly, the triage that all the states are going through is let's protect services first.
Yeah.
We don't provide direct service.
Right. Thank you very much for that update.
Thank you for all your work.
Mhm.
Yeah.
So, your thoughts now, so section 6 came known to us, just very late in the game. I didn't hear about it from you, didn't hear about it from the housing committee, but our trustee legislative council told us about it. And so what are your thoughts about this?
So thank you for the opportunity to speak with you about this. This builds on your committee's work. And so a couple of sessions ago, your committee worked really hard on a bill that became Act 186. And Act 186 launched some pilot planning grants. Those are all sort of up and running. People are living in some of that housing that you guys created. And there's $2.8 million in the budget to get one of those projects over the finish line. Act 186 also generated this housing report. One of you asked where the 600 came from. Why 600? It's in the report. The report assessed how much service supported housing do we need. It came up with 604 units. So the idea is, we're not going to get there with these one-offs and one at a time. We need a plan. And we want a plan that's actionable. The reason for the aggressive time frame is so that you will be able to come back. Chair Mahali wanted something by November 15th so he could meet drafting deadlines for December so that you guys, we are using language like actionable plan so that you have something that you'll be able to consider when you come back next session. And you'll see that some of you asked about where is the housing going to be located, where around the region. So we've been trying, the people who've been following up on this issue have been trying very hard to get information from DALE, the Department of Disabilities, Aging, Independent Living, about where are the people who need services located. That information's just been really hard to come by. So you'll see that in like the first or second clause of the plan, the group can ask for information from DALE about the geographic distribution of need if we find we need it. We're hoping to get some of that information from DALE before we start meeting. They are on notice that we need that information to go forward because everyone who's taught about this shares the concerns that you expressed about. We don't want all the units in Chittenden, that people live all over the state. We need units all over the state. So we're trying to match the units with the need. And the housing developers have been very clear about that. At BHCB, it was actually Gus Seelig that was trying long before this to get that geographic distribution of need. So we're on that.
Representative Eustace?
So the number 600 and folks all around the state, does 600 address the issue or just address part of the issue? As it exists right now.
Yes. So one of the trickiest things about this that I sort of hate about my job is I work for the Developmental Disabilities Council. And the way some states define developmental disability, people with physical disabilities like cerebral palsy, like any disability that occurs in the developmental stage would be considered people with developmental disabilities. And then we'd be talking about a number far greater than 600.
Okay.
But this 600 will get at the people with intellectual and developmental disability who have support needs. But the programs in Vermont are sort of broken up by physical disabilities. You have choices for care and brain injury. So this is for folks receiving services through the Developmental Disability Services waiver primarily.
Well, to carry on just a minute more, we wouldn't want to get in a situation where we're sort of chasing disabilities around the state to try to get people housed. It seems like there should be a stock ultimately a stock of housing that would sort of tend to be available to help solve the needs as they exist.
It's a question of capacity and where
Yeah.
you build the capacity.
Yeah, right.
And so Dale actually has in their annual report, they have which we have a copy of up there. They have where they're existing. So group homes, staff departments and stuff like that are located. So this is I guess, evolutionary process.
Yeah.
So, at one point in time, Dale's predecessor, which goes way back, was building group homes all over the state. And people would leave Brandon Training School and go to group homes, and then maybe transition to apartments or shared living providers. And in other instances, we had things called intermediate care facilities. Those are for people who had more, not going to say significant, but they had a higher service needs. So lots of times intense medical issues. Sometimes it was mostly around medical issues, people who really needed much more care than some other folks. And so there was a whole array of services that were developed during the 70s, 80s. Into the 90s, people started like, I don't want to live in group homes. I want choices about where I live. And honestly, we couldn't even fill vacancies that we had in group homes because
We just didn't want to be there.
or they didn't want to, like there was say there was a vacancy in Rutland. If you lived in Montpelier, you didn't want to have to move to Rutland in order to get residential services. You want to be able to stay in your home community. And so, that's, this report addresses that, but, so, I think that, it's kind of like any housing, where you need it will change over time. And needing to be able to sustain different options for housing. So, these are people who either currently live at home, they might live in some sort of shared living situation and they don't want to be there anymore. It's any kind of like variety of reasons that people might want different housing. And this is a variety of different housing. It's not all one
thing.
It's not one thing, right? It's meant to meet the sort of individualized needs of folks.
Which it doesn't really say that in here,
Right.
Yeah.
which kind of was a trigger for me, is
Yeah.
that it just says 600 units.
Mhm.
And to me, like, that doesn't really address like the individual needs of people, because we've heard how diverse the needs are and folks want options.
It doesn't, but I think, sorry, we're having
Yeah,
conversation here.
sorry.
Sorry. Let's let the
Yeah,
witness,
sure.
finish any comments she has, and
Yeah.
I'm guilty of it as well. So, why don't you finish with your comments, Susan, and then, we'll have some discussion and other questions for you.
So, thank you, Madam Chair. So in the questions that I heard raised, asked of the Legislative Council, there were some questions about how did we get to 600? What about the regional diversity? One of the other questions I heard that I really appreciate, particularly coming from this committee, is what about the voice of people with lived experience? So what I wanted to say is that the membership of this committee was sort of intentionally kept small, so it could be a functional, real work group. The committee was originally made up of state actors, kind of primarily state actors, and that is because, as Ledge Council referenced, before the session began, Vermont had been selected to be part of a HUD, Housing and Urban Development grant. It was going to bring together the housers and the service providers in an accelerator model. We were one of 6 states, going to be part of a cohort. No money was coming from it, but people would go to Maryland and work together, Baltimore. Well, that grant was pulled, but we wanted to keep those state actors together moving forward. And then we wanted to add some stakeholders. So Green Mountain Self Advocates, which is an organization of people with lived experience, is one of the members. The grassroots unpaid parents Developmental Disabilities Housing Initiative, who brought you the chocolate chip cookies. We'll have another member, the Developmental Disabilities Council, that's who I work for. Right now it says our executive director, so it'll probably be our executive director, but she works for a board that has to be, by law, 60% of people with disabilities and family members. She herself is a parent of 2 young adults on the autism spectrum and has had so much experience with these systems. So I don't want to dissuade you from the idea of adding language saying, you know, preference given to people with lived experience, but I did want to let you know that there will be people with lived experience on that committee. We thought it was a great idea to add the general contractors, the treasurers there, because one of the things that this brief makes clear and that we're starting to look at in other states is we have to come up with other financing mechanisms. It can't all be private, you know, there's got to be a public-private partnership, and other states have used governors' funds and bonds. So anyway, the treasurers there, we didn't really want to have a larger, you know, a committee much larger than this. But if your committee thinks that we missed someone, we're certain, you know, go for it. I think that the stage that it's at right now is that it's out of housing in general, but I think Ways and Means is still working on the tips on the tax sections.
Yeah. I mean, I think, to be honest, I don't really think the Secretary of Human Services needs to be there because her designee is going to be the Commissioner of Dale. Or, I mean, it could be the Deputy Secretary, but yeah, go ahead.
We're expecting and we're hoping for their housing person.
David Regal,
Yes.
he's the housing person. And
Yes, and he wears a different hat involving recovery housing. So one of the other things I haven't mentioned is that we are hoping to
We should
explore
say
their
model
model.
specialist then in the
Yeah.
Agency of Human Services. If that's what you want.
Dale's in there separately.
I see Dale's in there
Yes.
separately. I was just, what was running through my head was, oftentimes, single members of individuals with lived experience feel isolated on a group like this. And so I was thinking of ixnaying the Secretary of Human Services and putting in 2 members appointed by Green Mountain Self Advocates.
Oh.
So that we didn't broaden the group. And then, I'm just throwing out an idea if people are interested in this or whether they feel it's necessary or not. And then the AGC, I'm not even sure it would be the AGC. One of the other things that, you know, there's this nonpartisan group of private people who have gotten together and they're
Homes.
let's build homes. They're actually really motivated to build homes. And my guess is they don't have a full understanding of the needs of people with disabilities. And probably neither do Associated General Contractors. So I was just thinking about them as well. And so were people thinking that it needed to be more specific with regard to the types of housing? Or, yeah, go ahead. Yeah.
So I think I was trying to play with some thoughts, and I don't know if this responds to the conversation, but adding a number 5 in terms of what they're supposed to look at. Recommendations for locations in most need of such housing, including preferences for urban or rural settings.
I don't know what that last part says, including, that just means everything.
It's badly, no, which is more, which do
is more
people want?
preferable.
Oh,
Do
oh,
people
okay.
want to be
Oh.
in urban versus?
Oh, okay.
Yeah, that's not well
Okay,
worded.
I didn't understand what that. okay.
Right, right. Do we need some of both? Do we want it mostly in one or the other? Do we want to not leave out rural settings? But, leaving it open to what the input is, but something to encourage some feedback on that. Including whether there are preferences for.
So, so people have had a chance to review this language. I guess one of the things that, I am positive that they will review the report, that, Susan was just referring to, that was commissioned a couple summers ago. I mean, that's where all of this information comes from. They will be getting data from Dale to the extent that they have it, and Vermont Care Partners, because there are waiting lists of people waiting for residential services now at this point in time. And so, so if there is something, and it says at least 600 additional units, I guess I'm trying to figure out, is there something that people really feel strongly about that's needed in terms of amending this language?
I started us in our last session with legislative council, a number of questions, but from my perspective, they've since been answered and satisfied that I don't feel strongly enough personally
I
to
agree.
move to amend the language.
Yeah, in the context of this report, I think that's my connection.
Yeah, go ahead, Anne.
So I did have a little bit of a broader question before you were here, and it really relates to our jurisdiction in terms of, disabilities more broadly. And that is, the more that we use the term individuals with lived experience, the less it has any meaning unless we say lived experience of what. And because they have a whole section on people with lived experience in the one above this one, the other work group, which is about settings with universal design standards. I think it needs to say with lived experience of the need for residential centers that meet universal design standards for accessibility and adaptability. And I think it's really about all of those groups, and needing to say who we actually mean.
To be honest with you, I haven't read the section
Yeah,
5 above. With
And it's
preference
just
for
another
members
word.
with lived experience.
right. It's just like, but lived experience of what?
Well, especially since universal design is very broad
Yeah.
in terms of the applicability of it. But before we go there and potentially provide our input on yet another section,
Indirectly, it's on this section as well in
Yeah.
concept, but
yeah, I don't see that term used in section 6.
no,
that
we
phrase.
we were discussing it, but
Yeah.
it's like, okay, so here's another group.
Yeah, we wondered,
Which-
I wondered if it need to be added. And so,
I see. Yeah. And that's maybe just, I don't think that phrase needs to be, because Green Mountain Self Advocates is
Yes.
there.
Yeah.
And they are people, with developmental disabilities themselves.
Can I ask a question of the witness regarding this section?
Yeah.
And the members, I think you started to express appreciation that the Association of General Contractors of Vermont was included. Did I read
Yeah.
that comment correctly, or do you have any further background about how they became to be included?
They were included at suggestion of a different committee. And I think it was because that committee thought the voice of builders should be in the group. And My experience of doing this housing, linking housing and services work is that it's a total yes and. You've got to have the service providers and you've got to have the builders and the
Mhm.
building developers. And if you've got all of one and not the other, it's just it's gonna work.
One of the things that popped up for me is I recognize that VHCB is a little bit new in this area, and they have struggled in their current way that they operate to understand how to allocate funding, you know, in the broader context of funding for housing that funnels through VHCB. That was one of the things that it's not specifically addressed here, but obviously a funding plan would be necessary in order to, you know, to meet the actionable part. And I suspect, you know, with more experience, they will sort of develop that. But if we have any intent upon impacting that or how they view particular projects that are specifically intended for individuals with intellectual and developmental disabilities, then that would be something that I hope this group could impact.
Madam Chair, the work that this committee did last year and it's continued in the budget this year gave VHCB a mandate to prioritize in their development of housing people who receive home and community-based services. And during the ensuing year, a group of families from the Middlebury area began meeting with the Land Access and Opportunity Board staff, and then now VHCB staff, including Gus Seelig, is at these meetings to say, how are we going to make this real? Starting in Middlebury, where that huge development is going in with Summit Properties. And at the beginning of this process, I think people were very optimistic that these families would be able to become part of this community in Middlebury. And then it turned out every obstacle you can think of. No, CSAC can't get master leases because they did a financing package that precludes master leases. Whatever it was, no, there was an obstacle, another obstacle, another obstacle. So part of the language of this plan, of this section, says really specifically to identify obstacles and fix them.
Mhm.
Because the VHCB has already come to us and told us that the housing from the pilot grants, the Aquin 86 pilot grants that they funded in Waterbury and in Randolph was the most expensive housing VHCB has ever funded because of the two-person rule, which Madam Chair is very familiar with, was intended to keep out larger group homes. And so good things that were good ideas in the past might be obstacles now that need tweaking.
They weren't meant to keep out group homes. It just said that you had to be licensed if you're three or
If you're
more.
going to be,
I mean, that's still the case. You have to be licensed if you're three or more. So there's, and I don't expect that to change. I mean, I expect that people will still need to be licensed, but I mean, part of this is an understanding and and I think that's what the DD Housing Initiative and the DD Council has done, is continuing to do, and is to make sure that at the beginning stages of any of these kind of developments, so is that things like that, like you just talked about, that those are that we don't have restrictions on master leases for, you know, maybe a certain section of the housing development. I mean, big development going in on Shelburne Road. I don't know how many, you know, there should be a number of units there that could be available and accessible to people with disabilities. And I know that there's some are, but not necessarily service supported housing for people with developmental disabilities. And so I guess we're coming down to I'm not hearing an overwhelming need to change language in this section. And I think that, Anne raises a good observation that especially in places where it's general, like universal design is a very general, are you talking about people with physical disabilities? Are you talking about people with developmental disabilities? Are you talking about older Vermonters?
Older Vermonters.
Yes, are you, who are you talking about? It could be any and all of those folks for universal design. So in places like that, I think we should be, it's something
I'll chat
to,
with the chair.
Yeah.
About some thoughts.
yeah.
I think in my final thoughts that I just want to leave you with is a number of you have raised questions about that sort of amount to it can't be one size fits all. It can't be one place. It can't be one type of housing. We've really got to make sure we're addressing a wide range of needs. And what came out in the 186 process, won't shock anyone, is that there's some people with disabilities who want to live right in downtown Burlington in their own apartment, like on the street. And there are some people with disabilities who'd be very quiet, prefer a quiet environment, like the place being built in Randolph Center, just like everyone else, just a range of need.
Yeah, preferences. They have, people have preferences.
So there's some language.
Imagine that.
Yeah. So there's language. There are also some groups, people who communicate differently have come to have been elevated many times. There are some groups who want a different setting, and what we aim for in the language that's in the bill is an attempt to try to have a plan that's gonna meet those mixed needs and meet the needs of people with 24/7 high support needs, meet the needs of people who just need some homemaker supports or bill paying supports, whatever it is, so that everyone, parents can get their long sought after empty nest, and people with disabilities can have independent living. Amen.
Okay, any other questions for this witness? Okay, so just to summarize, it seems like we're supportive of this section and that we're not recommending any changes at this time. Or ever before it gets to the floor, because this is our opportunity.
Right.
Okay. All right, thank you very much, Susan, appreciate it. Okay. So I think folks have probably taken a look at the agenda for tomorrow. Just want people to recognize that we are going to be having quite a crew in here about conflict-free case management. And just so you know, that was really the last sticking point on the budget before that got signed off on. And it was a big sticking point. So part of our really oversight is to ensure that this is a federal requirement. Okay, so we don't have a choice in doing it, but to ensure to the best of our ability that this can be implemented with the least amount of disruption as possible to individuals and their families who are receiving services. And we are already starting to get reports of, and it hasn't even happened yet, but reports of of disturbances starting to happen. So, so we're going to hear directly from the two entities that are providing or will be providing these services. As well as representatives of designated agencies who are feeling the impact of this already. And then while we are not going to be voting on early childhood education and the Sunrise Report and the legislative recommendations that have come over in the miscellaneous Office of Professional Regulation, OPR bill, this is sort of teeing it up for next year. Again, we will have a bill on our wall next year that deals with this. And so this is to get some background. So the Secretary of State's office is going to review the Sunrise Report with us. And does everybody know what a Sunrise Report is? Okay.
The opposite of Sunset Report.
And you're so witty.
That's actually true.
It is true in this case. It is still
Be witty.
it can be witty at the same time. So when a group, so the Office of Professional Regulation at the Secretary of State's office does exactly that. It regulates certain professions. Not all professions, but if you are a profession and you wish to have the recognition of being licensed through the Secretary of State's office, they do what is called a sunrise report. And it is essentially, they do the background, they do the research, they determine if it is a public benefit to have a group of professionals licensed. And so it's a pretty involved process where they go through and they look at all the background, and we can ask some questions about that when they come in tomorrow. And then the conclusion is whether or not they recommend that this group of professionals be licensed or not. In this case, the Secretary of State's office has recommended that the group of early childhood education professionals be licensed through the Secretary of State's office. So that's what the sort of like the conclusion of the Sunrise Report was. Sometimes the Sunrise Report goes through that process and they say, no, we do not recommend this. I've seen that happen as well. So there are thousands of people serving in this capacity in the state. And so they look at it as a public benefit to licensed folks. So, but that is not going to pass this year. That is something for consideration next year. But we are going to tee it up by looking at the report and having them explain the process that they've gone through.
Can I ask a question?
Yeah.
You said something earlier I'm not quite sure I picked up on. Is there some part of miscellaneous bill
Yes,
that this appears in this session?
yes, but it's going to be taken out.
Oh.
So there was a companion bill to a House bill, which was number H-182, that is down in government operations. In Senate GovOps S-119, and they've taken extensive testimony on that in the Senate. They S-119 did not meet crossover, but they put it on the miscellaneous OPR bill, which is a House bill. I want to say 482 for some reason. I'm not sure why, but it's a miscellaneous House bill. And so that has now returned to the House. It's downstairs in GovOps. They'll be taking the childcare section out of that bill, and we will take it up as a separate bill next session, not this session, but so the folks in the Secretary of State's office are disappointed, but we need to take pretty extensive testimony on this. It's a giant change for the industry and the businesses, and there's pros and cons to it, and we need to be able to do our due diligence, and there's insufficient time to really do that at this point in time. And there are budget implications to go with it as well. Additional staff will be needed at the Secretary of State's office, et cetera. There's lots of, it's kind of like, throwing the pebble into the pond and seeing the ripple effects, and this has ripple effects out there. So we need to be able to do our homework on that.
There's
So
reasons for crossover.
there are reasons for crossover. Right. So, okay. Anybody have any other questions? Okay.